harsh parenting during the circuit breaker period. And finally, question 3, this is a main question. This is the key question for our study, where we look at parenting stress as a mediator. In other words, will parenting stress mediate the impact of COVID on the two parenting outcomes? And so let me just go into the details of my study. Will be the mechanics of my study. And so we did an online survey using Facebook pages and engaging some community agencies to help us to disseminate the online survey. We did it from the period April to May this year, which covers the first month of circuit breaker and then go on to the extended month of the circuit breaker. So parents have to be age 18 and above, living with at least one child age 12 or younger, living in Singapore, Singapore citizen and PR. In total, we have about 258 participants. Let me just talk about these 258 participants. All of them are married. Most of them are, about 32% of them are mostly 36 years old to 40 years old. So we're talking about young parents, mostly are Chinese, mostly mothers, and most of them have a university degree. Most of them are employed. So we're kind of looking at parents in this study who are young parents, mostly mothers, highly educated, employed, and likely to have high economic resources. So for the kids wise, we're looking at children who are mostly aged 0 to 6, so the preschooler age. Most of the parents here have one child, and 59% have at least 2 caregivers, which means about 41% have 3 or more, maybe a domestic helper. And so let me now talk about the study measures. To measure coronavirus impact, I use the coronavirus impact questionnaire. This consists of 6 items. All these items are all will be self-reported. It means the parents report about themselves. So this coronavirus impact questionnaire looks at psychological impact of coronavirus, financial impact of coronavirus, and access to resource impact, which means that it asks the parents, did they have difficulties accessing to the resources that they need? For example, medicine, food, or groceries. And for parenting stress, we use the parental stress scale. And I just want to point out that parenting stress is distinctly different from other sources of stress, like marital stress or economic stress. And in this scale, we ask questions such as, does respondent feel overwhelmed by the responsibility of being a parent? And finally, for the 2 outcomes, I construct these items by myself. Outcome 1, we look at harsh parenting. Basically, you ask parents whether they yell, scream at a child more often in the past week since the circuit breaker started, whether they use harsh words, whether they spank or they caned. Note that we focus on the period during the circuit breaker because it's the focus for our study. We also look at outcome 2, which is parent-child relationship closeness. We ask 3 items. How close do they feel to the child in the past few weeks? How often have they praised or complimented? And how often have they shown love and affection? And so now let me just talk about the results, focusing on the impact of COVID-19 on their finances, resources, psychological health of parents. 50% of the parents say that they experience negative impact on their finances. 40% of parents say that they have difficulties in getting resources. And for psychological health, 22% of parents felt depressed, while 37% felt that their psychological health was affected. So you might ask me whether, is this a significant impact? It's hard to tell because unless we have a baseline, let's say we know in the broad population of parents before COVID, how many of them felt depressed or their psychological health was affected. We don't have that, so it's hard to compare to a baseline. But if I convert that 22% into numbers, you're talking about 1 out of 4 or maybe 1 out of 5 parents. So if you have about 1 million parents in Singapore, there's about 200,000 or 250,000 parents who might have experiences of being depressed during the circuit breaker. And so was there a higher use of punishment during circuit breaker? 37% of parents had more conflicts or quarrels with their children. 47% had yelled at their child more often. This is about 1 out of 2 parents. 27% had used harsh words, while 13% had spanked or caned their children more often. This could be also underreported because parents might not be willing to share about whether they had used corporal punishment on their children. And so we come to the research question, the results. What did we find from our study? First, greater negative impact of COVID-19, which includes financial impact, resource impact, and psychological health impact. Those who experienced greater negative impact was associated with higher parenting stress. And for research question 2, higher parenting stress was was associated with poorer parenting relationship and higher use of harsh parenting during the circuit breaker period. And for research question 3, this is the key research question. We found that parenting stress is a mediator. So specifically what happened is that when parents experience more negative impact of COVID, they then report higher parenting stress. And in turn, when they report higher parenting stress, they also report more negative parenting outcomes. And so let me just begin to summarize my key findings before I move into implication for practice and services. Key finding number 1, COVID-19/circuit breaker affects psychological health, finances, and resources. We only look at these 3 types of impact because of the scale that I use, but it's possible that there might be other impact as well. In fact, we have another study that found that there was an increase in marital conflict as well. So for key finding 2, the key point here is that parenting stress is an important factor to pay attention. We see that how an external event such as COVID-19 or circuit breaker can impact parents by increasing their parenting stress. We also found that how parenting stress is a determinant of parenting outcomes. And key finding 3 is basically going back to our parenting stress model and suggesting that this is a useful model, not just for research, but also for practice. So for practitioners out there, if you are using this model to work with parents, you could be working on changing parenting relevant stress. So you could be helping them you may be looking at work, maybe looking at marital relationship. There are certain things that will be hard to change, for example, life events, or even certain historical events that parents might have experienced. Or you might be looking at parenting stress, helping them to work on parenting stress. This could involve like helping them to seek social support, helping them to use more adaptive coping methods. Or you could be also working concurrently on helping them with parenting behaviors. So this might be, instead of using harsh parenting, you might be helping them to use more positive parenting practices. And so now I come to implication for practice. Pay attention to parents' financial needs and resource accessibility. Psychological health is a good area to focus on. And I think even at this point where it's post circuit breaker period, as much as circuit breaker is no longer happening, but the pandemic is still a thing. So the impact of the pandemic on the economy will still continue to affect jobs. Even today, I think there were news in the news about higher retrenchment than expected. There was another study also done by the School of Public Health from NUS, and said that during the pandemic, those who were part-time workers, those who were casually employed, were the most impacted by the pandemic, by the circuit breaker. So I think it's very important for practitioners to continue to work with parents, continue to track with them, see how have they been doing since the last session that you have met them. Do they look more discouraged? Do they look more troubled by problems? So continue to work with the parents in terms of their psychological health and their financial needs. Help parents to cope with parenting stress. The second point, parenting by itself, even in normal times before COVID, is already very challenging. And during the circuit breaker, parenting stress goes up because of the lack of resources to deal with the parenting tasks. And even in post-circuit breaker period, if you go back to the parenting stress model, even though circuit breaker is no longer there, maybe that might not be a source of stress, but other events might occur in the post-circuit breaker that may continue to contribute to stress to the parents. One of the things that I'm quite concerned and we do not really know much about is the impact of circuit breaker on children. During the whole period of the circuit breaker, we don't know how this has impacted the children. And now I think kids are going back to school after 2 months break. They might be facing some challenges in terms of adapting. I mean, for me, myself, when I was young, I was a very introverted child. For me to suddenly take a break from school and then going back to school would be very difficult for me to adapt back to. And when kids begin to act out in terms of problems, that also will affect parents as well. So one of the areas for practitioners to look out for is the impact of the whole pandemic on children. And then we should also look at, because of our results, we found that there was an increase in harsh parenting, which is a risk factor for child abuse. Do assess for the severity of the parenting and the duration. you might find that in this session that the level of harsh parenting might be low, but in the next session, you might actually go up. So continue to track what has been happening for the families. In terms of implication for services, services to support parents, during the circuit breaker, efforts to connect with parents will become even more urgent because everything seems to be closing down, and parents might feel like the agencies won't be there to support them. So agencies will continue to need to show that your presence is still there and they're willing to continue to support them. Psychological services, counseling, and social work services are vital during circuit breaker. They should not be shut down. And I think in the post-circuit breaker period, I think agencies should begin to look at evaluating some of the services that they deliver, what went well for them, what wasn't too good, so that you can improve on these things, develop a kind of a working plan so that in future this can be taken out to use again, suppose if a circuit breaker comes back again or something like that. And finally, implementing online self-directed parenting interventions. Since office-based behavioral parenting interventions are not possible when parents are not able to leave their home. So this is something that I talk a lot more in my paper. Looking at delivering some of these parenting interventions that are self-directed. This means that parents can just look at the video themselves. They have the documents or the booklet that they can look at and they can learn the parenting skills on their own time. So this will be something that agencies can consider more about. And so I come to the end of my presentation. You can find more information on my study in this first link. I have most of my documents and my working reports all there. And you can also find the same my paper as well in my own personal website, my own academic website as well. And so this is my email address. Do feel free to contact me. I didn't have time to talk about the limitations of my study. So yeah, I'm open to for more questions if you have.
Okay, thank you, Gerard. Yeah. The next presenter is Ryan. Ryan serves in the capacity of corporate communications and outreach with the SOS, and he graduated with a Bachelor of Social Science with honors in psychology from NUS. And Ryan is very passionate for the social services, particularly spreading awareness in an area such as mental health, yeah, and particularly in the area of suicide, yeah. And his work in SOS has focused on public education, raising awareness, and upstream suicide prevention efforts. Yeah. So without further ado, let's welcome Ryan from SOS. Yeah.
Give me a moment while I figure this out. Yeah. Are you guys able to see the screen? Yes? No? Wait, are you seeing presenter mode?
Yes.
Oh, okay.
Yes, yeah, we're seeing
Sorry.
notes. Yeah.
Oh, gosh. Give me one moment. Yeah, I'm so sorry about this. Reading view. Oh, God.
Yes, I think it's good now. Yeah.
It's okay now? Okay, sure. Yeah. Thanks so much for Yu Wei for the kind introduction. And right now, I think thanks so much SSR for having me and SOS here. Like what Yu Wei mentioned, I'm Ryan and I'm with the partnerships and engagement team at SOS. I've been with SOS for close to 3 years right now, and I'm actually responsible for the communications and outreach work at the organization. At the same time, I think one thing I would like to share is that this is the first time that we are actually doing this survey, and it's something very new for us. And so I'm a little jittery right here. So pardon me if I say something amiss and things like that. All right. So just a little bit about the survey. Every day we listen to clients share with us their struggles and worries. However, at the same time, we feel that there is a need to find out more about what's happening on the ground, especially with those who we unfortunately have not been able to speak to So, therefore, it's sometimes better to understand the needs from the community, and in such a way, we attempted to do this community dipstick survey sometime in late May and June this year, especially during the end of the circuit breaker period. So to really get a sensing on the general challenges faced pre-circuit breaker and during circuit breaker. But at the same time, we also want to take this opportunity to really identify the help-seeking behaviors, especially when it comes to mental health struggles in the community. So to share what the interests are, why we wanted to look into the mental well-being during the circuit breaker is actually, in fact, from March this year, we actually have observed a larger than normal increase in the number of calls that were attended to on our hotline. Despite that, having the National Care Hotline being launched in April this year. So the spike, and rather in comparison to the previous fiscal year, what we have seen is that the rise in the number as compared to the previous fiscal year has been still increasing, or rather is still significantly more than the previous year. And we just wanted to understand what else are people actually feeling on the ground that it's not told to us through the hotline and through the different services that we have. So the demographics that we have in this survey, we actually surveyed a total of about close to 2,500 respondents who were in Singapore during the circuit breaker period. And as this survey was published online, and that our partners from the educational institutions helped us to spread the word around, we actually see a majority of respondents who are aged 29 and below. Also, the female gender take up the majority of the survey population. So let's just take a look at some survey findings. In order for us to observe the change in emotions, we actually got respondents to give a rating on a scale of 0 to 5 before and during the circuit breaker. So what you can see on the slide here is that we actually noticed that all ratings for negative emotions actually increased during the circuit breaker. And to actually zoom in even further is that we observed that the greatest increase was actually for the feelings of stress, anxiety, and loneliness. And something that we actually are quite surprised by is that, because if you already remember that in earlier slide, I mentioned that majority of our survey respondents are actually youths or from the age of 10 to 19. As technology natives themselves, during the circuit breaker, they actually mentioned that they feel a heightened level of loneliness, despite being so-called connected with their friends through social or through any other means via Facebook and Instagram. So then we actually kind of ask ourselves, then what about the other population that may be feeling the stresses of this during the circuit breaker and things like that? And at the same time, I think why the level of, some of our respondents actually shared with us that the reason for an increased level of stress is also because of, firstly, for students, it would be the additional work pressure, additional study pressure because of home-based learning. So they feel that they are actually lagging behind. And at the same time, they have this perception that there are constant addition of school assignments and things like that. Whereas for the working population, they actually mention about having to struggle with work-life balance and from the work from home arrangements. So these things that all accumulated together are actually kind of all these additional stresses, points of stress for the different types of respondents that we have. But in addition, the heightened anxiety is also, as as practitioners, I think most of us are already aware that during this current situation and during the circuit breaker especially, anxiety is something that comes up pretty often because firstly, right now is we are looking at the uncertainty with the job market and the financial and income instability and the stresses from that. But at the same time is I think especially so during the circuit breaker is the fear and the anxiety that what is this pandemic going to happen and how is it going to pan out in the future? So there are a lot of uncertainties around the community, and that's something that actually attributed to the increase in the anxiety levels pre and during circuit breaker. We also further asked about some common challenges that respondents actually face during this period. And what came up most often was that, like, I think just now Gerard actually mentioned, was something that echoed what we actually see during our survey was the challenging relations with loved ones. And this is also something that comes up pretty often during our 24-hour hotline. During in the chats for on our 24-hour hotline, where clients actually said that they feel very affected when they actually have heightened tension happening within the household, and it's something that during circuit breaker you can't leave the household and things like that. So it feels that prolonged periods of time with the household within the household actually creates some unhappiness and some misunderstandings and things like that during within the household. And something that is very interesting that we saw and noticed was that when we looked further into the feelings of loneliness and the struggles with one's mental health, we noted that students who are staying with parents actually feel 2 times more isolated and have more difficulty coping with their mental health as compared to respondents who are staying with a partner or a spouse. And I think from this finding, we actually kind of tell ourselves that, physical proximity may not necessarily mean that, one person is not feeling lonely and he or she should be feeling like, oh, I have everything going well and things like that, and I feel comforted. But instead, it's more of the psychological distance that one actually feel with the people around them. And which is why I guess in comparison to the following slide, I think when youths and children actually realize that staying at home actually creates more tension, they feel like there is a need for me to get out of the house. And that's also something that it helps to release some stress where it may come from perhaps from parents who may be looking out for them like almost 24/7, I guess. And it feels like, they don't have any sense of freedom in that sense. So that's something that it struck out to us that, oh, we didn't know that the difference would be that big. And, as SOS is a suicide prevention agency, we generally are always interested in the general opinions on suicide. And from our survey, actually, we saw that 3 out of 4 respondents actually feel that suicide is a way to escape pain. I think from this, our observation kinds of tell us that respondents do empathize that with individuals who took their own life, that they may actually have been suffering a great deal and have exhausted all means to help cope in their situation. But at the back of their head, it's something that is very concerning as well. It's simply because it gives us the impression that, perhaps suicide is always an option as a way to escape pain. And it's something that we are very concerned about on like, how can we then further increase the resilience amongst our community, or especially amongst our youth, so that when things go bad, we have to keep going on and to find this necessary support around us to weather the storm together. And that's something that, we have been trying to really look at on how we can further build the resilience, the emotional resilience as well, within our own population. And when it comes to help-seeking behaviors, I think a lot of times the public messaging have always been focused on, encouraging people to seek help when they need. But at the same time, I think we understand that the first step to talking about one's mental health struggles and one's own personal problems is it can be a really huge obstacle to all of us. But at the same time, I think it questions and it gives us, gets us thinking on whether this message that, please seek help if you need, is it sufficient to actually change behaviors, and whether is it sufficient to really encourage someone to step forward to talk about what their struggles may be. In fact, when we ask our respondents that, whether or not they will consider talking to others for help when they're feeling emotionally overwhelmed, 34% actually mentioned that they will not. But on the other hand, actually, we see about 70% actually mentioned that should they really look for someone, the first point of contact and the first group of people that they will actually turn to is actually their friends. And friends are like probably the most, they feel the most comfortable opening up to friends as a pillar of support. And that's something that we wish to capitalize on to ensure that friends always provide that avenue of emotional support and support to generally everyone. But at the same time, I think in relation to understanding help-seeking behaviors, we also wanted to understand what are exactly the barriers to one's intention to seek help. So from this slide, the most prominent observation would be that the majority of respondents actually reported that they feel that when they reach out, they actually have the impression that nothing will help, even though I reach out. I reach out for help. Whereas for other kinds of barriers, they actually also include that when they talk about their emotions to someone or their friends and their loved ones, they feel that they actually feel that talking about it is going to disappoint the person. And at the same time, with social stigma and as well as embarrassment, it comes from a place whereby they feel that they have lost all hope and they have been in despair for so long, and they feel like, all of the things that I'm feeling is actually just a source of me just belittling myself and just reducing my own self-worth. And which is why it feels like all these things are all self-inhibitions to the individual that inhibits the person from actually just wanting to talk. And something that is that's one important thing that we actually saw, and we wish that every one of you can take away, is that respondents who actually revealed that, shared with us that they themselves have had thoughts of suicide, actually share similar ratings to those who have spoken to someone who had suicidal thoughts before. And this somehow points us to the importance and the need to create safe spaces and to create more conversations, because it's through these conversations and honest conversations with someone who is struggling, it helps open up our own worldview, and it helps us to build on the empathy and the understanding, and as well as the compassion that we should have between one another. And this is something very important that we have been trying to stress to the community at large. And one more thing that we actually saw in this survey is we are actually asked about the barriers that inhibit someone to support one another. And the common fear was that individuals feel that their approach may actually make things worse, that they don't, and at the same time that they don't know what to say. Although we are actually very encouraged that 30% of our respondents will not hesitate to reach out to someone in distress, I think we we are coming from a point whereby we really hope that this 30% will increase, and at the same time address to better educate and better make aware that, you know, sometimes making a supportive attempt is better than making none at all. Because a lot of times when individuals are feeling emotionally overwhelmed themselves, all they really require is an avenue and someone that they can turn to that will be willing to listen. And that's something that, you know, we cannot stress enough, to really get people, especially our society and community, to really be more willing to be there, be present, to really listen to one another. So what we actually saw here is that individuals who are struggling who are actually in a very dark place and are struggling, they actually hesitate to reach out for help. While on the other hand, people who are concerned, they actually hesitate to offer help. So then we actually question ourselves on how can we then meet somewhere in the middle. So in some sense, like change some behaviors when it comes to mental health support within our own society, within our own circle, that when someone is in crisis, perhaps we get that there is a fear of like asking for help. But at the same time, I think we need to start building a community that we are more concerned for one another and reaching out to show your concern and to show that you care and that you are always in this journey with them. It can actually change someone's life. And that is something that we wish to see more of, and we are trying to see how we can actually develop that in that sense. So from a communications perspective, we actually have started to really, and we'll always continue to actually encourage ground-up initiatives to shine light that there is hope. And that many of us will probably be more willing to support and willing to lend a listening ear without judgment. And it's our core belief that the support from the community is ultimately a very important part to play in terms of suicide prevention. And yeah, so I think before I end my sharing, I'd like to say that, you know, we can all do more to be a pillar of support to someone by listening, showing genuine concern, and with less judgment. And with that, I end my sharing. Thank you.
Thank you, Ryan, and thank you, Gerard, for the two very wonderful presentations. Yeah, I learned so much from the both of you. And I think particularly it really struck me that, you know, this whole pandemic, you know, there are many people who talk about the economic impact, you know, of the pandemic. Of course, there's the health impact of the pandemic, yeah, but there's this whole area about mental health and emotional well-being that is often kind of, you know, less spoken about, or people are more hesitant to talk about some of such impact. And clearly both of you have showed that, you know, whether they are your parents or whether you're a young person, you know, the pandemic has really caused quite a lot of stress, you know, on various groups of people. Yeah. So before I go into the Q&A and to direct some of the questions for both of you, and I will welcome, you know, the audience as well to, you know, type in your questions for the panelists in the Q&A section. Yeah, but before I do that, I have some questions for Gerard and Ryan. Yeah, so maybe first of all, I'd like to ask Gerard about your study. Yeah, and I think your study has kind of really showed us that, you know, even kind of middle income or your middle SES parents already feel quite a lot of stress during the pandemic. And we can only imagine that, you know, parents who are less resourced or with less resources could possibly have be facing like even more stresses during this period. But so far what we have seen though is that the government's response to support families is mainly focused on very short-term or immediate kind of financial or employment assistance or retraining. Yeah, there's not much other than the National Care Helpline. You know, most of the government response is, you know, in terms of the immediate kind of financial assistance and very short-term. I just want to ask whether, you know, the crisis looks like, you know, it's going to be quite long drawn. what do you think are some of the, say, longer term support or government policies that can, better prepare parents or to mitigate some of the negative impacts brought about by the pandemic? So that's the first question for Gerard. The second question for Ryan. Really like to, because I like the fact that you talk about a lot of how we as part of the community, whether we are a friend or someone who needs help, or whether we are someone we love is suffering from mental health issues, or our colleagues or our friends. But there's a lot of focus in recent years in developing this kind of community mental health approaches, and particularly in public education, and understanding how we can all play a part to help someone. So if you kind of like in an ideal scenario and in your own vision, if I mean kind of like in a situation where if you have all the resources in the world, what is the vision that you have? What do you think is that kind of ideal community mental health model, and what should that look like? Yeah. Okay, yeah. So feel free, to whether Gerard or Ryan wants to answer my questions first.
Gerard, you want to go first?
Sure, I can go first if you want. I think I feel that parents that I know, they're all very savvy. After what has happened now, if this thing was to happen again, I think parents will probably know what to do and what to buy. Like even for ourselves, for myself, stuck at home with my kids, even over here as well, our version of circuit breaker, we will subscribe to different online shows and all that. And so I feel like Singapore parents, they will be quite savvy to know how to actually prepare if this were to come. But of course, it would be tougher for low-income families who may not have the resources like the middle income, which are the most of the parents who we study in this study. And so certainly any financial handout would be helpful for low-income families, cash in hand, or even to be able to subsidize rental fees, and certainly would be very helpful to alleviate the stress. I mean, if you go back to the parenting stress model, what causes the parenting stress would be some of these stressful events. So you want to look at what are some of these stress, so that might actually reduce this stress. In terms of long-term solution, like I said, you continue to have to track these parents. How are they doing? Because the whole impact of the pandemic is still a thing. It's still happening, and you still really going to continue to work with them on this. I guess from an intervention point of view, you might say remedial intervention. The problem has occurred. We continue to see how we can mitigate the impact of this. When it comes to the other side of remedial, would be then to look at preventive or even to developmental. I actually felt that one of the things that we can actually probably do better is actually to strengthen the community. And I felt like it was a very good opportunity during this COVID, during the circuit breaker, for actually neighbors to come together to help one another. I actually heard of different stories. Like I know of a private estate in Singapore, executive condominium, where all the residents, they band together, they order food every day together, so that they can all work together to save money on the delivery fees and all that. And I know of initiative from the community. Like one of my friend, she would pack bags of play stuff with different kind of play things and then they distribute to low-income families too. So I felt like one of the things that we could probably do to prepare for future pandemics like that is to actually build the community. And for me, I would just define community as anyone who you can show love to, and possibly the one who's nearest to you, your neighbors. And as like one in Ryan's slide, a lot of the people surveyed, they actually want to talk to friends. So I was wondering, the whole circuit breaker was an opportunity for people to begin to take initiative to connect with their neighbors and to build the kind of support for one another. Maybe they're essential workers in these families, and maybe they need help with groceries. That's where we all can ask ourselves, what are things I can do to help the people who are nearest to me? And I think we can build this kind of community using a crisis, because crisis create opportunity. If we can build this community, I think that will help parents to be more prepared for a crisis like that, or even something else, not just a virus pandemic.
Yeah, I think I mean, what Gerard has actually mentioned, it also closely links to what, that the question posted to me about like my ideal, how my ideal world would be like, especially for mental health support. I think we always emphasize that the community support is always paramount importance, because that is what we always term as the upstream prevention. Is before an individual actually go down the continuum that of struggling with their mental health to the point whereby they actually think about suicide as an option. It's a very long process, and it's not something that happens almost immediately. And so with a strong community support and a strong sense of identity with the community, I think it really can help in terms of long-term prevention in some sense. And I always remember something that my ex-boss actually told me, that the most ideal world, I think in some time in the near future, hopefully, is that one day we will see that there isn't a need for a suicide prevention agency, because we are so interconnected to a point whereby we just provide support to one another when things go bad. And like what Gerard said, in a crisis, it creates opportunities. And during this crisis, we have actually seen so many accounts of people stepping forward to really show support, whether is it to the migrant worker community or any other communities that really needed help. And it comes from the place of genuine concern and genuine care, that it actually helps to promote all this sense of giving and sense of the sense of, I can be there to support someone even though I don't know him or her. It's really building on this identity and this sense of belonging, to want to see our country move forward in a more caring and more compassionate sense. Yeah.
Thank you. Yeah. I'm just looking at the questions in the Q&A section, and there are quite a number of questions, and I'll just run through some of them, particularly those that have quite a lot of likes. So on top of the list, I think it's a question to Gerard. There's a question on, do you think there would be a difference in the findings if your sample consisted of parents who are from lower SES backgrounds? Yeah, and what would some of those differences be? Yeah.
I don't think there will be a difference in the main findings. We still find that COVID-19 will have an impact on increasing parenting stress, and parenting stress will also increase in negative parenting outcomes. What we'll find different will be the effect size will be greater, because if you base back on the parenting stress model, parents from lower income families, this is a generalization. We did not consider social support and protective factors, but if you just look at the parenting model, lower income families will probably experience more stressful events, economical stress, and employment, irregular employment. So there'll be other stressors that will also contribute to the parenting stress. So I would expect that the effect size will be even stronger for low income families.
Thanks. I think there are a few more questions for Gerard. There's one where someone asks, are there different levels of parenting stress among parents with children of different age groups? And children taking national exams this year, younger children or toddlers or teenagers. Yeah.
For children taking national exams, I know from personal experience it's very stressful. So that one I'm quite sure about it. But for studies have shown, mostly from not from Singapore, but they do show that parents with younger children, they usually have higher parenting stress than say parents with older children, like adolescents. And that was one reason why we decided to focus on 0 to 12 years old, because the circuit breaker has closed schools, childcare centers, and felt that this is the population, the subpopulation that we really need to focus on. And so I would expect that the stress level will be higher for parents with young kids. And if let's say they have other conditions such as disability, then it will be even tougher for them. Yeah.
Okay, thank you. Yeah, there's a question for Ryan. Let me see. Has the narrative of suicide and suicide prevention has been mostly individualistic? Like seek help, check on their friends. And because suicide is often the point where people are already kind of very overwhelmed and a result of multiple social environmental stresses like school, peer relationships, lack of employment, low income and all that. So how do we kind of relocate suicide as a social issue rooted in convergence of social inequalities? Yeah.
Wow, I think this is a very difficult question to answer. I think to look at suicide as an issue it's a public health issue. And something that we always tell ourselves is that our response to every problem is always different from person to person. And we may have addressed certain issues, let's say the lack of employment and things like that, which are very much external. But does that actually help build the internal resilience and emotional resilience within ourselves as a community? Not say that we are saying that the individual needs to help themselves or build up their own resilience, but it's more of how can every one of us help build each other's resilience. Our resilience to know that when things go bad, we are not necessarily alone. And there is comfort to know that when things aren't going as what we wanted to how it would go through, there will always be someone to be there to journey. And it's something that helps us build our own idea that, maybe there is hope after all, because I'm not in this alone. And so we aren't saying that, looking at suicide as a social issue per se, but it's more of how can we better build this community to know that, regardless of what issues come our way, what external issues come our way, whether is it a crisis, a pandemic, loss of income and things like that, we know that I will be supported no matter what. And I think that's something that we need to always emphasize. Yeah.
Thank you. There's also another question for Ryan. It has always been a concern that those who do not have the skills might do more harm to those who are suffering from mental health struggles. And that's why, they hesitate to kind of reach out to the people around them. How do we then build that kind of confidence, among people in the community? Yeah.
I think this question is something that we constantly ask ourselves, that how can we create more awareness that, everyone actually go through difficult times, and how can we actually be of support? I think one thing to really take away is that we have to provide support to how that individual requires support and not how we want to provide it. It's like that individual may only wanted a listening ear, but for me, maybe I wanted an advice. But we have to understand that not everyone is about it. Not everyone thinks the same as I do. It's more of how can I better support the individual in the way that that person requires support, instead of thinking about, this helps for me, it probably will help for you, kind of thing. And we have to build that awareness to. So in some sense, I think for us, we feel that mental health awareness and awareness on how we can be a better support to one another is still at a very infant stage. So we have to do more. Perhaps for this individual who asked the question, perhaps we can actually discuss on collaborating together. I think agencies collaborating together to send that message out, to promote this messaging out there. can do, we will probably see a greater impact in that sense. Yeah.
Okay, thank you. I'm quite mindful of the time, and it's now almost 10:35. So we're kind of like 5 minutes beyond. But I'm just wondering, because there are quite a lot of, there's still quite a lot of very good questions in the Q&A. I'm wondering whether maybe Gerard and Ryan, you want to have a quick kind of scroll through and maybe pick 2 questions to answer each, before we close the session today.
Yeah, I there's some very good questions on coping.
Yeah.
So we are looking at protective factors. These are things that I did not address in my study. And this is something that's also very important to work on. And that's why models are always very limited. The parenting stress model, well, actually not true. This parenting stress model also do include social support as well. And so we need to also consider parents' coping skills, social support that they also receive. A couple of questions on whether do we have any insights on coping skills from the study. We do have possibly an upcoming study that we're looking at social support. We actually asked parents to tell us using open-ended question how they actually cope during the study. And I just want to summarize the results from there. We actually did text mining on that, and we found that the top 3 most prevalent coping methods that parents use to cope with the stress during parenting, during circuit breaker was, the first one is spousal support. Second one is actually setting up routines and schedules every day for their kids and also for themselves, because parents, the wife has organized with the husband, okay, you do the morning shift and I do the afternoon shift. So setting up schedules is important. The third one is actually managing their own expectations. And one of the things that parents say is that they realize that actually this whole thing, the whole circuit breaker affects almost every parent. And knowing that a lot of parents are also experiencing this, it makes me feel better that I'm not the only one alone. So these were some of the coping topics that people talk about.
Yeah, I think another thing that we actually observed from our survey is that we did see very minor differences between, let's say, age groups and things like that. Age groups being one. I think for the question on racial differences, we didn't really check on that. So we don't have an answer to the question by Nadira. So, however, based on age groups, we actually did not see much of a difference in terms of the fluctuations in the emotions before and during circuit breaker. However, what we actually saw in the differences in the challenges faced were actually by their employment type. So like what Gerard actually mentioned previously in his sharing was that people who are unemployed or employed on a part-time basis, we actually see a higher stress rating and a higher anxiety rating simply because of their current situation. That they are very much unaware or rather uncertain about the near future on how things may pan out. And especially so during this period whereby we are continuing to hear more retrenchments and that our retrenchment rate has been, I think, 2 times more in yesterday's papers. It's something that it will actually create more anxiety and more fear and worry amongst the entire population. And I think, which is exactly why we feel the need that, like what we have been talking about is the need for this community support that, regardless of what happens, we are stronger together and we are really here to really see this crisis through. And that's something that we really wish to push this message out further and wider.
Okay, thank you. Yeah, I just have a last question maybe for both Gerard and Ryan. Yeah, because I've been hearing a lot from both of you that, we need to look at resilience and we need to look at community building up, that kind of community resilience and all that. Yeah, but in such a pandemic when, possibly everybody is suffering from some kind of impact of the pandemic, right? And maybe all of us are all very, very stressed. Yeah, so in a sense, how do we depend on the community when everybody is like very, very stressed and everybody is kind of also coping in their own ways? Yeah, yeah, during such a crisis, yeah, then what can we do? Yeah.
Wow, another very difficult question. I think what we always practice is that firstly, you look within yourself. Be mindful of what you're feeling first. If you're not feeling that good today, it's perfectly fine. Okay, and when you feel that, oh, I am feeling slightly better, pass that feeling on to someone else. Express your concern and to check in with whether it's your neighbor or your friend, dropping a text and asking someone, how are you doing? I'm just checking in with you and things like that, showing your concern. I think a lot of times, especially when we deal with looking at youths, when youths actually use social media too much, I mean, they express themselves online more often than not. What we see is perhaps they may have mentioned something that may be worrying, and it just takes one person who is actually concerned to just reach out and say, hey, I'm here. If you need someone to talk to, I'll be here. And it's really that willingness to reach out. But ultimately, it's really first look within yourself to ask yourself whether am I ready? I mean, am I in a good headspace to actually be that support for someone else at the same time?
Yeah, I think I just want to also at the same time address what Nicolette you has talked about, how social workers, they themselves are trying to help clients, but they themselves are also stressed because they also are parents. They themselves are also being stretched as well. Actually, this is also one of the research questions I was really very interested to look at. I just didn't have the resources to do it. I don't have solutions for this because this whole thing is very new, and that's why I wanted to study it to see how social workers who are parents themselves also cope with work during this period of time. But I think one thing that I can suggest is for agencies at this point, maybe during post-circuit breaker period where things are maybe a bit better, to be able to come together and share best practices about how they did their home visits, how they did their teleconferences or whatsoever, so that people can learn from it. What are things that help workers to be able to deal with the work burden and all that? So yeah, this would be a good suggestion to agencies. Yeah.
Okay, thank you very much. Yeah, Ryan and Gerard. Yeah, I'm also wondering, like, in such a crisis where almost every one of us are affected. In fact, I think every one of us is greatly affected by the pandemic in all sorts of ways, right? Whether it's also kind of to prepare us for future crisis, that we need to kind of strengthen some of the basic structural resilience. Yeah, so it's not just individual resilience, but the whole policies and the kind of structures and institutions also must play a part in a sense, especially in terms of, I was thinking, like, for mental health, we don't have enough mental health professionals, right? And the kind of training that we need to give mental health professionals, we need more psychotherapists, we need more psychologists. Yeah, we need more people who are trained counselors who are able to handle people who are in great stress and in great mental anxieties. Yeah, and to really recognize that these are really conditions, there is a public health concern, and we need professionals as much as we need each other. We need our friends and we need our loved ones. We also need professionals. And for parents, we need social workers who are very trained, and we are also in great shortage of social workers, and senior social workers, and there's also themselves struggling with burnout. They're also themselves struggling with coping with some of the pandemic, high caseloads and that sort of thing. So as a system and as a structure and as some of these institutional measures, I think we need to also strengthen those things to prepare us for the next crisis. Because one thing is for sure, this will not be the last crisis we will face. Yeah. So instead of us scrambling again next time, and then all wondering how do we cope with this, I think there's so much more that we can do to strengthen the systems and the system resilience. Yeah. But I'd like to close this session. I'd like to thank both Gerard and Ryan again for sharing with us so openly this morning. And I'd like to thank also the audience for putting in their questions and staying with us. Yeah. Thank you, everyone. And please look out for our next webinar. Yeah.
Bye.
Thank you.
Thank you, everyone.
Hi, before we close the session today, hi, I just want to make an announcement or rather a publicity for our next webinar. Okay, as you know, this is the first of our three-part series on COVID-19 response and impact. So next in October, we are going to invite 3 speakers from Beyond Social Services, from AWARE, and from South Central Community Family Service Center to join us. This session will be moderated by Dr. Ng Kok Ho from the LKY School of Public Policy. And we'll be also commemorating the International Day for the Eradication of Poverty, which coincidentally also falls in the month of October. So, well, you can sign up right away you can scan our QR code and sign up right away. Consider this as an early bird registration. If not, the official EDM will be out on next Monday. You can sign up via our mailing list or our Facebook. Yeah. Thank you very much for your attendance today, and we hope to see you in October. Thank you.
Thank you all.
Tim? Tim?
Yeah.
Hey, is that just me and you now?
Hang on, I don't think. I'm trying to figure out.